Of coronavirus cases spiking in Mississippi, doctors are seeing vice versa trends with who's getting infected the most. Recent data from the Department of Health shows the last 2 weeks, predominantly white communities have been contracting and spreading the virus. 12 News' Alex Love joins us in studio after speaking to an investigative reporter about what's driving the trend. Alex?
Absolutely, Melanie. Over the past 2 weeks, Mississippi has averaged about 759 new COVID-19 cases per day. More than half are from white patients in counties majority white. One of the top political research agencies, Pew Research, shows politics might be fueling this surge.
New graphics released from State Health Officer Dr. Thomas Dobbs illustrates white Mississippians making up over 61% of COVID-19 infections from October 5th through the 18th. Almost doubling the cases of African Americans.
Over 60% of new cases in the past 2 weeks are in Caucasians, and over 60% of new deaths are in Caucasians. So we've seen a significant shift and a drop proportionally within the cases and deaths in the African American community.
Latest reports from the State Department of Health show Hinds County, the once hottest spot for COVID-19 spreading, only saw a 4% jump in cases the past 2 weeks, while Lincoln, Hancock, and Benton, with a predominantly white population, increased by double digits. None are part of the governor's mask mandate.
In the white communities, really what we're seeing is it's a question of compliance. This idea of wearing masks has gotten very politicized, and you're just not seeing the same rates of compliance among white Mississippians.
19 different studies and research projects gathered by the Center for Disease Control illustrates the common way COVID-19 spreads in droplets through the air and on surfaces gets cut off by a mass barrier called source control.
A virus's job is to stay alive. It stays alive by moving through groups, and then once it's moved through a group, it moves on to another group. It's tearing through white communities right now, and the cycle is going to continue. If it comes back around for communities of color, I think the health outcomes in many of those communities, just due to access to health care, they tend to have worse outcomes from it.
4 of the top 5 Mississippi counties showing the highest rates are predominantly white and voted for President Trump in 2016. Pointing investigators to political views, driving their attitudes to not take precautions.
There's politics and then there's facts. There's politics and there's science. They've now become intertwined. And if science is something you don't like, it's because it's been politicized. Probably like the biggest legacy of Trump's presidency.
Even though there is no longer a statewide mask mandate, the governor is still encouraging all Mississippians to wear a mask.
In her analysis, Larison Campbell spoke to pastors down in Lincoln County to see if they'll require masks once they switch back to indoor services. Their response was sticking to personal choices.